Hello, everyone. Today on the She Found Motherhood podcast, I'm talking to Stephanie Miska, and we're talking all things sleep and pregnancy. And today's focus is going to be using alternative and complementary methods to help support sleep and treat insomnia in pregnancy.
Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high-quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the fourth trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood, or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners.
She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated.
So, Stephanie, welcome to our podcast.
Thank you. Excited to chat with you today.
I'm super excited about this conversation. So, guys, before we started recording, Stephanie and I were just talking a little bit about this. And I feel like this is actually going to be a super helpful podcast for a lot of people. So Stephanie and I actually met through Instagram. We are both local to Victoria and provide healthcare to pregnant people. And so Stephanie reached out to me, and we've actually chatted a bit in the past just about the work that we're doing. And we're both trying to promote, evidence-based and safe therapies for pregnant people. And Stephanie and I started chatting a little bit, and she was telling me about some of the work she does with people to help with sleep. And I was telling Stephanie about how many pregnant people I see in my practice that are struggling with sleep, whether it be insomnia, frequent awakenings, excessive fatigue. And Stephanie was telling me about a lot of the really cool stuff that they're doing at their clinic to help pregnant people. So Stephanie, I just wanted to start by asking you to tell us a little bit about you and the work that you do and how you got into it.
Yeah, absolutely. So I'm an acupuncturist and herbalist. I'm a doctor of Chinese medicine, so that encompasses those two modalities, acupuncture and herbal medicine. I have a small clinic here in Victoria, BC, and my practice focuses predominantly on reproductive health and perinatal care. So we see a lot of folks coming in with just needing general support with their menstrual cycles and hormones, and also support through pregnancy and postpartum as well. So we spend a lot of time, helping women through their pregnancy journey and through the symptoms that sometimes arise during that as well.
Awesome. And can you tell me I'm more just being curious, a little bit about your training. Where did you train?
Okay. Yeah, absolutely. I actually started training here in Victoria, BC, and then I switched schools and went out to the interior to Nelson, BC, and finished my 5-year Doctor of Chinese Medicine training there. So that is a 5-year program. It includes acupuncture and herbal medicine. There is board exams at the end. It's a regulated body that governs us here in BC. And it's a pretty intense programming that covers a lot of general healthcare. And then through my interests over the last few years in my practice, I've really honed in and done extra training specifically for reproductive and perinatal care as well.
That's really cool. I'm really excited. So, like I mentioned, our focus today is going to be sort of insomnia and supporting sleep. And so, I thought by maybe starting, if I have a pregnant patient that comes into my office and she's struggling with fatigue and sleep, like we were saying before we started recording, typically our approach would be to talk about general sleep hygiene, good bedtime routines, making sure they have comfortable, they've got a pregnancy support pillow, massage and physiotherapy. But really that is the extent of my expertise, before moving on to the next level, which would be medications, pharmacotherapy, which we really try and avoid if we don't need them in pregnancy. So if I were to refer her to you, can you tell me a little bit about what that would look like and how you would assess and recommend different therapy options depending on her symptoms and how she's presenting?
Yes, absolutely. So like just sort of more logistically, there's the act of like calling the office, getting booked in for an initial consult. Every new patient, no matter what their complaint in, comes for an initial consult where we just sit down and chat for a few minutes and just I assess whether I think acupuncture can help and whether we're a good fit to work together. And then after we look over your symptoms and your complaints, I will give you the recommended treatment plan. And that's where I think people using acupuncture sometimes miss out, is that we really need to focus more on the consistency and frequency of treatment, or the consistency and frequency of the diet or lifestyle changes, because it's really about those gentle nudges more frequently that we're going to see better results than one-off treatments. I mean, oftentimes people fall asleep on the table and feel really great, but we are looking at supporting you throughout either your entire pregnancy or this like phase where we're not sleeping super well. So we go over what that might look like, and depending on the severity of the symptoms, so whether someone's sleeping absolutely not at all, or just waking periodically through the night, that will decide how often we're going to see each other. And we're going to, the patient's going to come in for acupuncture treatments anywhere from 1 to 3 times a week until those symptoms have resolved.
Oh, that's great.
Yeah.
So do you know if there's much sort of evidence or literature behind using acupuncture for sleep in pregnancy?
Yeah, there is a little bit. There's, of course, more studies that need to be done. Based on a few studies that I did find, there was, using acupuncture during pregnancy did actually decrease the insomnia score in up to 50% in 75% of patients that were receiving acupuncture. So that's a pretty high percentage. And then there was another study done this year that shows that acupuncture can significantly improve the sleep quality in pregnant women. They're thinking it's possibly through the increased melatonin secretion. However, more studies need to be done to sort of solidify that. But we're starting to see more and more evidence, showing the benefit of acupuncture for sleep. It's a really safe, side effect free modality to try. And the benefits are usually pretty great.
Yeah, that's awesome. So basically what you're saying is it's not like a one time you go in, you get your treatment. But, depending on your symptoms and the severity, you may go 1 to 3 times per week over a series of weeks to help support through the rest of the pregnancy.
Absolutely. And it's going to depend on your symptoms and then your progress throughout the treatment plan too. So if we see each other a couple of times a week and you start sleeping through the night, then we'll space those out. We might see each other once a week. And then if you're continuing to sleep throughout each night, then we'll space those out even further. The goal is just to make sure that we're supporting you often enough that our symptoms aren't dipping back into where they started, so that we can continue that treatment and those gentle reminders of the body of what we're trying to accomplish, which is ideally a full night's sleep. And once we've achieved that, then we look at how to maintain that or space out the treatments until we need to check in again, or if at all.
Yeah. And then other than acupuncture, are there any other sort of therapies or recommendations that you guys would typically make above and beyond what we limited Western medicine doctors can do?
Yeah, absolutely. So with like acupuncture, herbal medicine, when someone who's not pregnant comes in, I will almost always also prescribe herbal medicine, so herbal formulas. When pregnant folks come in with insomnia, I do not use herbal formulas too often. Every once in a while we will, but we might look at other like calming teas, even just like chamomile, lavender. And then we're going to look at like the symptom patterns in the body and see whether it's like just insomnia or if there's other things going on. So we like to differentiate between someone who's just extremely fatigued and someone who's having a hard time sleeping, because someone might think they're having a hard time sleeping just because they're tired all the time. We also look at other things that might be getting in the way of sleep. So sciatic pain, back pain, headaches, physical tension, and things like stress and anxiety, heartburn, digestive disruptions. There's usually a secondary thing. So if someone comes with insomnia, we're going to look through other things that are showing up in their symptom patterns and then address the symptoms based on that. So if someone's coming in and they're like utterly fatigued and utterly exhausted and they're like not sure if they're sleeping well, we're going to look at lifestyle and exercise that is going to be a bit more like nourishing and supportive and rejuvenating, as opposed to really exhausting and tiring. So like a comparison might be like a Yin Yoga class, some like mindful movements like Tai Chi or Qigong versus like a spin class or a HIIT class. If you're really, really tired and feeling really like run down, likely a spin class or something more high intensity is not going to be really nourishing and supportive, and might actually make you feel more run down and more depleted. Whereas if you're someone who's a bit more like pent up and tense, feeling a bit more stressed, anxious, maybe some anger, there's a little bit more like fiery energy, moving those emotions through higher intensity exercise may be more appropriate so that the body is able to move that through and then relax a little bit more in the evening to hopefully have a better sleep. We also look pretty strongly at diet and nutrition for those same sort of similar patterns. If someone's feeling like pent up and stressed and tense and we're going to avoid certain things that in Chinese medicine, diet therapy may also contribute to those symptom patterns. So things that are maybe a bit more like spicy, oily, greasy foods, like fast food, curries, things like that. And then if someone's feeling really like depleted and fatigued and exhausted, we're going to look at maybe trying to supplement a bit more with like soups and stews and nourishing foods that are easy to digest, maybe a bit more bland and a bit more like nourishing and supportive. So it kind of gives you like sort of a brief overview of how we will take, if many patients came in with insomnia and we would never treat them all with the same recommendation. They come in for acupuncture and then we'd look at the other symptoms that are presenting and then make some recommendations and give some advice based on that patterning. And that's where, sometimes we just know that we are supposed to move. We are supposed to, get exercise during pregnancy. We're supposed to do all these things. But not always is that like the most appropriate thing based on like how you're feeling, what your symptoms are, and where you're at in your pregnancy. So it is important to maybe, if possible, to like seek some other like healthcare advice, whether it's an acupuncturist, a nutritionist, or someone has some training specifically, hopefully working with pregnant folks to assess where you're at and what's like more specific to your needs, as opposed to like a general like base thing that most pregnant people are probably supposed to do.
Yeah. I really like how you, like the focus on movement, because I agree movement is so important in pregnancy and in life in general. Like we get so busy in here in our brains that we forget that we have a whole body and that, our emotions, they're in our whole body, right? Like we have a nervous system throughout our body. We have our gut has its own nervous system. But what I really like is how not everybody needs the same movement, right? Like, today for me, I am exhausted. I'm really glad we're doing a podcast, not a video, because you can see how tired I look. But, for me, I think a yoga class or a nice walk outside would be better than, my usual, I'm obsessed with my Peloton, but I think today I need to not do an intense Peloton workout. And I like the idea of supporting people in movement in terms of where they're at in with their symptoms and in their pregnancy. And I actually was wondering if you could talk a little bit more about Yin Yoga, because I've heard about this a little bit, but I don't know much about it. And I'm actually really excited that you brought it up because I think that it's like sleep yoga, question mark?
Question mark. I feel like sleep yoga might be more something like yoga nidra. Yin yoga is going to be, and so this is actually another thing to consider. And, when if you choose to go to a yoga class and you go to a yin yoga class, to make sure your instructor knows that you are pregnant, because the poses that you hold in yin yoga are held anywhere from like 3 to 5 minutes. So depending on where you are in your pregnancy, really stretching out your joints may not be the most appropriate option. So yin yoga is not necessarily the most passive type of yoga. It's more like stretching and allowing expansion in our joints and our muscle tissue. So we hold these poses for, extended amount of time. Restorative yoga, which, might sound similar, is it going to be a little bit more passive, a little bit less like stretchy, maybe a little bit like just more relaxed and more comfortable. And that might be something that's more appropriate, like later on in pregnancy versus like the yin yoga, because we might hold a pose that's moderately uncomfortable for an extended amount of time to see like the depth we might get. So that can be appropriate earlier on, but it's still going to be sometimes a little bit more uncomfortable. But the restorative yoga is the piece that's maybe it's more passive. You have lots of pillows and blankets. You're just doing like light, gentle, like twists and movements and stretching. And that is going to be a little bit more like relaxing and calming on the nervous system in a little bit more of a passive way.
Yeah, no, that's really great. And do you yourselves, like in terms of, Tai Chi and Yin Yoga, do you have local people that you refer to, or do you teach people yourself?
I do not teach people myself, but
Or there are
all of
online places that we can refer people to?
yeah, there definitely is. In locally like in Victoria, there's all the studios will offer Yin Yoga. There's different types of like prenatal yoga. I'm a big fan of Helga Beer and her yoga classes here in Victoria. She's been doing prenatal yoga for a long time, and it's also quite like, yeah, restorative and gentle and a really supportive community. So just a plug for her. She's great. And, but any studio will offer Yin classes, and you might be able to find like specific prenatal courses to check in with. And I can send you some links for virtual
That'd be great.
yoga. There's lots. Yeah.
Yeah.
I think that's great, obviously, for people who are like trying to stay home, maybe during COVID, and don't want to be in studios. But I also really love seeing like relationships flourish between teacher and other students that are pregnant together going through the series, and the relationships that continue like past delivery. And if it's available to create that community for yourself ahead of time, I think that's really important too.
I agree, and that's something I think that, when we spoke the first time, we were talking about community, because with this pandemic right now too, right, there's not as much gathering happening. And I know there are still yoga classes happening, and they're doing them safely and spacing. And I actually went to Helga's classes when I was pregnant.
Oh, did you? Oh, nice. Yeah, she's been doing it for a long time. So.
Yeah, we'll put a link to her classes in the show notes. And she offers workshops and stuff, which is really
cool. Okay.
Yeah. And then the other thing, I think it's really great, and maybe this, when people are listening, they can start to sort of think about, is you mentioned the sort of what we would call like concurrent symptoms like sciatica and acid reflux, which definitely could impact your sleep. And maybe you could talk a little bit about how you would help support those symptoms in pregnancy, because those are definitely two that would like lead to insomnia if you've got raging nerve pain down your leg.
Absolutely. Very uncomfortable. Well, even just this past week, I had a patient coming in who the first time, 36 weeks with pretty severe sciatic pain, low back pain. And it doesn't always happen this quickly. However, we treated her once, and when she came in a week later, her sciatic pain was gone.
Wow.
So, I use a mixture of, cupping therapy, which, you can Google or look into what exactly that is, but it's a little like light, gentle fascia and muscle massage. And then we'll do acupuncture needling, potentially like depending on where we are in pregnancy, like right around the low back and like where the sciatic nerve is situated. And then we'll also often use distal points. So in acupuncture, our meridian systems run through from our organs, through our nervous system down to our extremities. So we can address, say, our sciatic nerve, our low back pain through points in our hands and feet, which is still very, very effective. And so we can, if depending on how we can lay comfortably in the bed, we can still address sciatic pain, whether we can get into the low back or not. But it can be really, really helpful with pain relief as well. And then I also had a patient come in last week who was having pretty severe heartburn, acid reflux, and we focus on acupuncture points that like clear heat and elimination, or clear heat and inflammation in the body, and just try and like settle the stomach a little bit. And then we talked about just drinking some like warm lemon water in the morning, and just those simple tricks seem to do it for her. So she comes in, every couple of weeks for acupuncture because she's feeling relatively good. And then we give her some tips and tricks to try at home for the heartburn specifically, like maybe laying on an exercise ball, trying to like open up her chest and diaphragm to create more space where there might be a little bit of like compression most of the time. And then, things like, lemon water before meals for her seem to do the trick. So it is, trial and error, like give some suggestions, try some things at home, because it's never going to be the one size fits for everyone. But those are just some of the things that we incorporate as well.
Oh, that's so great. I find acupuncture really fascinating. I went for it. I've only actually gone when I was pregnant. I went to try and turn my baby. He was not breech, but he was OP, so facing the wrong way. And he came out the right way.
Okay.
And so I did cervical ripening too, and he came on his due date. And then I had back pain in my second pregnancy, and I was like very concerned because, as you know, a lot of back pain just can be persistent throughout pregnancy. But I did massage and acupuncture, and it was managed, and then I was symptom free for the remainder of the pregnancy. So It's really
Good
powerful.
to hear.
I don't understand the science, but I know it's there.
Well, for you physicians, and if you're any physicians listening, The Spark in the Machine is a great book. It's written by a physician turned acupuncturist, and he does talk about some of the science behind it, which is super interesting. One thing that I wanted to just touch on too is like we look at their nourishment, and so we might use the words in Chinese medicine like qi and blood that it requires to develop a baby and to go through labor. Now that can be quite taxing on the system, and there's a really strong emphasis on getting enough nourishment, and that nourishment doesn't just include food, but it includes like nourishing exercise and social time and also sleep, just to help us through like the postpartum period as well. And so I'm not sure if you're familiar with or heard of something called like the sitting month or the golden month. It's something where women after they gave birth would stay home for the first month, like 30 or 40 days. They may not leave their bedroom. They definitely wouldn't leave the house or their property. People come to them and bring food, and they're really like nourishing, restoring, and repairing their body after, pregnancy and delivery. And we look at how nourishing yourself in terms of like sleep during pregnancy plays a big role in our like postpartum recovery and repair and mental health as well. So, the importance of getting enough sleep is really, really, of course, important, but we can see like the benefits or the, if we're not getting enough sleep, the repercussions longer term, because, potentially we're not going to get a lot of sleep for a little bit of time. So it's good to get as much sleep as we can.
Yeah. It's really interesting you say that, because I was just in my office, yesterday and the day before, and seeing a couple of my lovely patients who are, nearing birth in the last sort of month of pregnancy. And a lot of them are, whether they're sleeping or not. And I'm like, it's such a cruel design, because we all know babies need to eat. Well, if you don't know now, babies need to eat every 2 to 3 hours, right? So you're really not getting restorative sleep when you're waking that frequently. And if we can support good sleep up until birth, because labor itself is a really exhausting experience. And then to try and recover from that, as well as look after a newborn, coming in with sort of your tank as full of of sleep as you can is like hugely beneficial.
And when we talk about like the nourishment in terms of like in Chinese medicine, we'll say like qi and blood, we can look at that in the nourishment of like food, and we look at how nourishing ourselves postpartum can have a really big impact on our own mental health and sleep as well. So we like things that nourish that qi and blood again, but really simply like, bone broth and soups and stews and things that are like really nutrient dense and easy to digest. And we have herbs that we use that are safe postpartum and during breastfeeding that we can like add and incorporate into some of those like medicinal bone broths, even just things, like peony and angelica and astragalus, again, like in really gentle, low doses is like, can be really like supportive. And we're trying again to be like supportive over time, because postpartum doesn't stop at like 1 week, 2 weeks, 4 weeks, 6 weeks, like it goes on. So how can we just continue to support our bodies as we're transitioning into this new phase in our life as well?
Do you guys ever do like workshops? Like, I mean, you wouldn't do anything in person now, but like a virtual to sort of teach pregnant people about this sort of side of things, like in the nourishing and how to support yourselves postpartum?
You know what? Not really.
I'm thinking that would be a cool thing to do.
Yeah, I popped into Helga Beer's yoga classes sometimes and done a little presentation for her yogis that are there. So we do that kind of thing. But yeah, not since COVID. And stuff. It was something I'm definitely interested in. I would love to consider that more. And actually I'd been in talks with a few other places in town, specifically about postpartum care, doing some workshops and talking about food therapy and things like that. But obviously COVID kind of stuck a wrench in some things. So we'll see.
Yeah. Well, as a Chinese medicine and acupuncturist, do people's benefits cover, do some people's medical benefits cover your visits?
Yeah, most do. If you work for the provincial government, you usually have a pretty good benefits package. Most employers do provide, and it'll be up to a certain amount. So I always say the benefits, are a really great starting point. Depending on what your needs are, they may not fully cover all of your like requirements for treatments, but it's a really great enhancement in benefits. If you're only getting, $100 or $200 for acupuncture, that only covers a couple of sessions. So, There are a few other options for like low cost options in town too. There's a couple community acupuncture clinics for people that need that more accessible option. MSP also covers a small portion of treatments as well. So it does include like a variety of other modalities, but you get 10 sessions covered at $23. So that covers a portion, but that would include if you were going to acupuncture, physio, chiro, and everything.
Yeah.
But it does. Yeah. So I would say check in with your provider and see what they cover, and then reach out and see if you're like our clinic direct bills too. So that means like if you come in, you give us your insurance information. If they cover your whole treatment, you walk out without having to actually, pay anything out of pocket.
Yeah. It's funny. It's a question I get a lot, and we don't have benefits as physicians because we're like self-employed, which is crazy. But I personally think it's worth like, people, you have to like weigh the, pros and cons. But for me, that is a cost that I think is, your sleep, your nutrition, it's your health. And I think that's something that it's always important to remember. Like we'll go and spend $10 on a latte these days. Seriously, right? Yeah. But it's great that people's benefits can cover it, because I know costs can be prohibitive for some people.
Yes.
Yeah. And if people wanted to find you, either on social media or, website or in person, where should we send them?
Sure. Well, our clinic is called Focus Health Clinic. We're just south of Jubilee Hospital in Victoria. So you can find us focushealthclinic.com and on Instagram. And for my own personal, where I post a little bit more about like reproductive and perinatal health, is on my Instagram page, which is @ritualmedicine, @ritual.medicine.
Awesome. So I really appreciate chatting with you. Is there anything else you think we should know about supporting sleep and pregnancy that we haven't covered?
Just looking over my little notes I made.
No, because we were talking before we started, and we did talk about melatonin, and I just will mention that we chatted with our perinatal pharmacist at the Victoria General Hospital, and she said there are some animal studies that possibly show harm with melatonin. So we are recommending avoiding it in pregnancy. So if some people are taking it, we would recommend that you stop. There's been no human studies because we can't really study in humans, but if it's shown in animal studies, then we typically would, convey that over to us, because that's the best evidence that we have. So we typically recommend avoiding that. There are medications that we can prescribe that are not unsafe. We just try to should be, second and third line, and we should support, a more holistic look at sleep, which is definitely what you're doing.
Absolutely. And I appreciate you touching on that melatonin piece. You mentioned previously too, that gravel might be an appropriate option. Is that's something you might recommend to your patients as well? Or?
What I would say is if you have literally had 5 nights where you've not had a wink of sleep, it would be not unreasonable to take some gravel and Benadryl are both safe in pregnancy. So if you're just I'm so tired, I just need to sleep, doing that one-off here and there is fine. It's not something that we would recommend for a nightly routine.
Okay.
But they are safe in pregnancy, right? So, or diclectin.
For sleep.
Yeah. So I had to take diclectin in my pregnancies. And my first pregnancy, when I took it with Henry, I couldn't go to work the next day. I was so out of it. It was so sedating for me, and everybody responds differently to it, because it is, so diclectin is, doxylamine succinate and paroxetine, which is vitamin B6. And the doxylamine is an antihistamine, which can be really sedating, because Gravol and Benadryl are antihistamines, right? So for some people, I was able to stop taking it about mid-trimester, and then every once in a while I'd be like, Mama needs a good sleep. Diclectin for me. But if you're having such trouble sleeping that you're needing medication nightly, that is not a medication we would recommend long-term. So we would say talk to your provider about that.
Okay.
Yeah.
Yeah. Beautiful. I appreciate you touching on that.
Oh yeah, no problem. It's important to know what's safe and not safe in pregnancy. There can be some confusing information out there.
There is a lot of information out there. Yeah.
Awesome. Well, thank you for chatting with me today, Stephanie. That was super helpful. And hopefully tonight, everyone has a good night's sleep.
Thanks so much, Sarah.
Bye-bye.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.